An abdominal hysterectomy is an open procedure done to surgically remove the uterus and cervix through an incision in the abdomen. It is also called a TAH, or total abdominal hysterectomy. A TAH is done for benign fibroids, leiomyomas, endometriosis, and cancer. Routinely, the patient is placed in the supine position. On occasion, by surgeon preference, the patient might be in low lithotomy. A Foley will be inserted before the procedure begins to check for bleeding in the urine during the procedure. It is also done to decompress the bladder and monitor intake and output. There should also be a vaginal and abdominal prep performed. The incision made is a phalansteal or bikini incision. Some of the specialty instruments that will be used for open abdominal GYN procedures, like a TAH, are Haney forceps, Haney-Ballantyne forceps, Haney needle holders, Jurgensen scissors, and the O'Connor-O'Sullivan, which is a self-retaining retractor. An abdominal hysterectomy is a very methodical procedure. You will participate in a lot of clamp, cut, tie, so be prepared. Common suture for TAH is O and 2O vicryl. Pops are often used. Sometimes the clamps are left in place on the uterus until the specimen is removed. Uterine leiomyomas or fibroids are dense, benign tumors arising from the smooth muscle tissue of the myometrium. They usually occur in women older than 35 years of age and usually develop within the body of the uterus. Although not cancerous, they can cause bleeding and, when very large, may impinge on other structures of the genitourinary system. A myomectomy is the removal of these fibroids. The goal of surgery is to remove the myoma, the leiomyoma, or the fibroids to decrease pain, increase chance of fertility, and decrease abnormal bleeding. During surgery, the surgeon may inject the fibroids with vasopressin or pitressin, which are vasoconstrictors that reduce bleeding while removing the fibroids. A radical hysterectomy can be a Wertheim or pelvic extenuation. The Wertheim procedure is less invasive than the extenuation, but both are used to treat gynecological malignancies, with endometrial cancer being the most common type of cancer of the female reproductive tract. The Wertheim is basically a hysterectomy with lymph node dissection, and an extenuation is much more extensive. A salpingo-oophorectomy is the removal of the fallopian tube and ovary. The patient could be having just the right tube and ovary removed. This would be a right salpingo-oophorectomy, or RSO. Likewise, the removal of the left tube and ovary would be an LSO, and both would be a BSO, or bilateral salpingo-oophorectomy. The tube and ovaries are removed for benign ovarian tumors, potential prevention of ovarian cancer, endometriosis, or for very large ovarian cysts. Be careful with medical terminology. Know your abbreviations. Know that a TAH is just the removal of the uterus and cervix. A BSO is the removal of both tubes and ovaries. Microsurgical reconstruction of the fallopian tubes is also called a tubuloplasty. The obstructed portion of the tube may be removed and the remaining tube is put back together to create patency. This can be done to reverse a BTL, which is a bilateral tubal ligation. The surgeon will inject methylene blue or indigo carmine into the uterus to check for patency.